most famous physical therapist on the internet.
Hi, folks. I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
We are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
Stiff, painful ankle. We have a 5-step routine to stop pain and loosen and avoid surgery. And
Right.
You've got some little stories here we can tell.
Yeah, not little stories,
But
but
big stories you can tell.
yeah,
I
actually,
didn't mean to diminish them.
right. You know, so many people, ankle sprains are one of the most common injuries.
It
You
is.
know, and that's statistically true. I've got two friends. They're both, one's 55, the other one's about 50. They've injured their ankles in their early active years, in the teens and their 20s. And just left the injury going. The doctor says back then, well, you're going to have arthritis when you get older.
Right.
Sure enough, the one had a stiff ankle, got stiffer and stiffer and stiffer through his 40s, ended up ankle replacement at age 55.
Wow.
Right now, he's in rehab getting this ankle, and the ankle replacements don't go very well. They're not real good at them yet.
I don't think they are either. It's a very complicated joint. It
Yep,
moves in multiple planes.
Yep.
And so I agree.
Yeah.
I a lot of times I've seen fusions.
Yeah,
You know, I mean,
which
the-
is not very good either,
No,
because
that's
it
not very
changes
good either.
your walking gait
Right.
and your life quite a bit. So either way, it's not a good thing. This other gentleman, I just saw him this weekend. I only see him usually once a year now, and same thing. Ankle's getting stiff. The doctor said, "Oh, you might be needing surgery on this." Said goodbye. And so he said, well, is there anything I do? I looked at it, and sure, there's some exercises that may loosen this ankle up and prevent, if not for sure, prolong if he does
right
need
when you
surgery.
do get the surgery. Yeah,
Right.
it's amazing how often this stuff works. I
Right.
mean, where you can actually think, God, I'm bound for surgery, but if you do some of these things, you can put it off indefinitely and maybe sometimes permanently.
Sure.
I mean, so
Sure.
by the
So-
way,
oh,
if you're new to our
oh,
channel, please
we're-
take
we
us.
forgot that.
I didn't. By the way,
This is for my buddy Spike, by the way. That's his nickname, Spike.
Spike, wow.
Sorry about this prolonged.
that's quite a name.
Just fast forward through this for another minute, and then you get to the heart of the
Spike, if you're new to our channel, please take a second to subscribe to us. We provide videos on stay healthy, fit, pain-free. We upload every day. Also, Spike, this is a great week to go to bobandbrad.com, go to the giveaway section, because we're giving away a whole massage lounge.
Oh, yeah.
I mean, you're going to be the envy of all your friends if you get all these products. We got
yes, your wife
hand
will love you more.
massagers, yeah, back massagers, foot massagers, all to one person. One
Yeah.
person gets the whole thing.
Mhm.
Go to the giveaway section, or you can go to facebook.com, Bob and Brad. If you want a short version of us, go to Instagram or Twitter. What are you looking at, Brad?
Look at the time. We're already 2 minutes into
I
this.
know.
Well, I
Wow.
hope too
Here
many
we
people
go. We
didn't-
told you
All
told
right.
a story.
Yeah, okay, here we go. So this is what you're going to do if you do have that stiff ankle, and I'm assuming you've got a good ankle. You're going to put your 2 feet right next to each other. It's a good idea. Take your shoes off. And then go up and down with them and see if one's limited. Oftentimes you're going to find out usually the one that's involved will lack dorsiflexion or pulling the ankle up. So this one goes up to here normal. If this one only goes up to here, that's an issue. Or pointing down. If one goes down to there and one goes to there, then you want to work that range of motion more. Probably the most predominant loss.
Are you going to check in and out too, or not really?
Well, yeah, you can go like this. Can you see that, Liz? Keep your heel planted on the floor, and you can point in with your heels not moving and then point out. And you can see if there is a big loss that way. Sometimes this one goes in here and this one doesn't so much. And we can work that range as well. But oftentimes, most of people are going to be working.
yeah, I would say
plantarflexion.
dorsiflexion is the biggest one.
Right, right.
Pulling the toes toward you. Because, to be honest with you, after you sprain your ankle, you might actually have more mobility, like in inversion.
Right,
Because that's how you
right.
normally, I mean, that ankle may actually move more than the other one. And that's not necessarily a good thing to be having a lot of motion in and out.
Right,
So
exactly.
we're really concentrating up and down.
Yep. So
All right.
now this is a big thing, and you probably have arthritis in this painful ankle. It's losing range of motion. You're starting to walk funny and compensate and whatnot. And oftentimes out of bed in the morning, it's stiff. And when you get up and walk, it hurts. After you've been on it for a few minutes, it starts to feel better. If that's the case, before you get up, as you're laying there sleeping, get up, get that ankle like this. If you can do the figure 4 position, I call this, and you're going to start working that foot up and down. And again, the range that you lost more, probably dorsiflexion. You can see if you can See, I wore these blue socks just so you could see it. I didn't want my
No, they're
dark
kind of
ones.
fancy.
Yeah, they're pretty. And I'm gonna push up, and don't forget to bring the toe up too. It's not real important, but it's a good thing to do because it's all part of the same
Yeah,
group,
help part
muscle
of that
group.
help that plantar fascia too.
So you're gonna work that about 10 times and stretch it out pretty good, and then you can work it right to left as well. Get it, and then after that, just do some ankle range of motion actively. We call that, and then get up and go about your day. And that should help that initial weight brain be more comfortable.
You might be surprised what difference that makes for
Right.
getting out of
Yep.
bed in the morning.
Exactly. Now,
Um,
the primary goal of this, I'm going to show you some more aggressive stretching, which is going to really get to the heart of the people with stiff ankles. But if you consistently, if your ankle feels better, like after a warm shower or a warm bath, and the heat feels like it loosens that ankle up and it doesn't swell up after that, if you want to really get after it with heat, we're going to show you a little trick too, as far as hot pad that really gets into the ankle. And oh, Bob's already has it on.
If people are wondering why I got this thing on my foot, so this is a Thermatex infrared heating system. So normal heat, and even if you put your foot in a hot tub
Right.
of water, it's just going to penetrate very surface.
Skin deep.
Yeah, skin deep. Thermatex infrared heat actually will penetrate
2.36 inches.
2.36 inches. So imagine that. That's going to go into the joint itself
Yep.
and really provide some relief to you. Most people I know with arthritis like heat. I
Mhm.
mean, very rare do you see someone that likes cold. with
It happens
arthritis.
though. I've seen it, but
It
usually
happens.
not.
So anyway, the reason we're going to bring this up is because Thermatex has their yearly sale. They have a sale once a year
Yeah.
where they really knock the price down. These are really expensive. So this is the time if you're going to get a Thermatex. I mean, if you're going to use it, we use it for our backs,
Right.
Brad and I, but you can use it over the entire body. And I just got it wrapped around the ankle, and we'll have a link below on the sale of that.
So the beauty of this is, just bear with us, but this is wrapped all the way around. So if it goes over 2 inches on one side and 2 inches on the other, you're going right through the
Right
whole
through the
ankle
joint,
joint, unless
yeah.
you've got a very large ankle. But even then, you're going to get very
Yeah.
good penetration with it. So that you leave on for 15 to 20 minutes, and then you could go to these stretches to really get it.
Yeah, it'll be
stretched
really
out.
quite warmed up. At that point then.
Exactly. So I want to show a couple stretches you can do without any equipment at all, except for you got to have your shoes on.
Yeah, it makes it a
this
lot
one.
easier.
Yep. There's two. It's called a wall stretch to work that dorsiflexion. Very simple. You can do this any time of day as long as you got a wall or a tree. And this is the ankle that's getting stretched, not the one in front, the one with the shoe on. Point it straight ahead and try and push your heel to the floor. Okay. And then you're going to hold that, 15 to 30 seconds, do that 2 or 3 times. And you can do that throughout the day. Another one, if there's a staircase around, we don't have a full one, but you'll get the right idea. And there's a handrail, something to hold on to. You put your foot off the edge of one of the steps. Bob's afraid I'm going to fall. I'm not
Yeah.
going to fall,
Well, I'm
Bob.
afraid the thing's going to tip on you.
I don't worry about that, but it's a good idea. So now I'm stretching there. This might be too aggressive because at the corner of the step, just make sure everything is gripping well so your foot doesn't go down like that and you get hurt. And you're going to, again, hold that 15 to 30
That's
seconds.
a really good way to stretch. So I use that one every morning.
Sure.
On the staircase.
Yep.
You can hold on to the rails, and it's just an easy, comfortable way to do it.
It is.
So,
The next one, which is more aggressive and does, I think, work better than either one of those,
sure.
is if you use an incline board. Now, I'm going to show you, this is a homemade one, and if you find these effective, you can buy one for about 30, 40 bucks online, or you can make one if you've got some scraps around. And actually, we have a video. It's a Bob and Brad YouTube incline board on how to make this. It's about 10 minutes long. It's it's a nice video like this one.
Sure.
But now this is really helpful. The key about this is you have to have some anti-slip tape on here. This is like
non-skid.
Yep, it's like
non-skid surface.
sandpaper, and that makes a big difference. Otherwise, your foot
Yeah,
slides
you're just
down.
sliding right down.
Yep, and you're going to do it with your knee bent and your knee straight. 15 to 30 seconds, whatever you tolerate, and do that once or twice a day. This is another way to make an incline board. It's simply a piece of plywood and a 2x4. cut the 2x4 a little narrower, screw it and glue it down. The nice thing about this one is you can do it like this, and you can do some plantar flexion like this. And if you're one of the people who want to work inversion and eversion, you can work it this way a little bit. Not many people are going to do that.
Right.
I just wanted to bring that up. So that's just a more of a quickie.
Yeah, very simple
Homemade
device
one.
to make. Yeah.
But this, the bought ones don't work any better than this.
Right.
I made it, so that's why I say that. But it's true. The other thing is, here's two. They call them Pro Stretch. Spiky, you'll like this. This was made from an idea from a old brake drum. And I know Spiky knows what that is, but you put your foot in there and it rocks. And some people like this better. I like the incline board better than this, but this does definitely get after it.
Well, the
pretty
only
good.
reason I like it is this the Pro Stretch Plus, I believe. I mean, it
Yeah,
has that toe feature,
right,
and so I stretch my toe back, which is really good for plantar fasciitis.
right.
Especially, it's a good prevention thing. For it,
Sure.
too. So that's the only reason I like this. So
Now, the only other thing there's something called a wobble board, which we have a video on how to make one of these as well. It has just a round ball on a piece of plywood. You got to have the anti-stick tape. This one has it painted on. And this, you can work all ranges at once. And it really does a nice job that way. That might be helpful for some people, particularly if you do a lot of walking on uneven surfaces, like I know Spiky does with his job. He's not.
you're
He's
going
not
to
at
get
the
some
desk.
strengthening with this too.
Sure.
I mean,
Yep.
that's,
Yep.
So I mean, you can go. You want to just show real quick? You go forward, back,
Oh,
side, side, and then circle.
right. So yeah, you can make a system out of it. So you're doing plantar flexion, dorsiflexion,
Side to side.
right, left, and
Circle one way.
circles, and circles clockwise, circles counterclockwise. And you can do these with weight bearing, but you have to have something to hold on to very steady, like a walker,
Right.
which we don't have
Yeah,
available.
we don't want
Um,
to injure your ankle by doing exercises. So you wanna make sure
Exactly.
you have plenty of support.
Exactly. If
Uh,
by chance you do get after your ankle too aggressively and it swells up, you're not going to put the hot pack on it. You're going to put a
No,
cold
right,
pack
then you're
on of it.
going cold.
Leave the
Yeah.
heat away for a few days. This is something, again, that you're going to work on consistently at least 5 days a week for a number of weeks. This may take weeks or months
Well, it
to
could.
regain.
These are tough joints to stretch.
Yep.
And they respond slowly.
This
Were
is
you going to recommend this in a night splint, Brad, or not?
well, I was going to get into that, but I didn't have one available, and it
It might give some.
it gets a little confusing between that and the planner thing.
Right.
I had talked to Spike about that too, and we both got confused about it, and I think we should probably
Just forget it. Okay.
Oh,
All right.
I was going to say something, Bob.
Okay, let's see. Well, let's hear it.
I can't remember. What I
Oh,
was
yeah.
gonna say. I got the gist of it is there. Do these exercises. Again, it's a slow, long-term progression, so be patient with it
Stick with it.
and avoid that surgery if you can.
Persevere.
Yep.
Yeah. Keep us updated. Thanks for watching.
Adios.